Morning and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terence Dial Singh, the Chief Medical Officer, Dr. Roshan Parasram, and Dr. Rohit Doon, Advisor, Health Promotion, Communications and Public Health. The Minister of Health, the Honorable Terence Dial Singh, will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning to the Chief Medical Officer, Dr. Roshan Parasram, and also good morning to the first time appearing here will be Dr. Rohit Doon. The reason for having Dr. Doon this morning is to address the issue of long-stay homes, homes for the aged and elderly, and how we are dealing with that going forward. So good morning to ladies and gentlemen of the media and to the listening and viewing public wherever you are. Ladies and gentlemen, WHO sent out a very sobering release yesterday, a very sobering report, which basically says that the world and all countries should focus on the first wave of the virus. Many countries are thinking that they are in the second and third waves, but what WHO is saying is that we are now in the second peak of our first wave. This runs maybe counter to what many countries were saying, that we are experiencing a second wave, a third wave. I would just like to quote from the WHO's release yesterday. WHO says we need to put up a fight now during a peak in the current wave of the coronavirus, rather than focusing on when a second wave might come. Now, this is a very new and disturbing way of qualifying and quantifying what is happening now. Right now, we have 11,231,300 cases. So what WHO is saying, these 11 million cases, every country that is peaking now is that they aren't experiencing a second and third wave. They're experiencing a second and third peak of the first wave. Dr. Michael Ryan, it goes on to say, said the world will be much better at fighting a second wave. So they are predicting a second wave outside of this 11 million cases, if people can learn the lessons of fighting the first wave. WHO officials emphasize mask wearing, social distancing, and hygiene by individuals. They say governments and individuals should contour their policies and behavior based on the outbreak status in their countries. And this is what we have been emphasizing for months now, that the simple public health measures of wearing masks when you're out in public, the social distancing, the hand sanitizing, is what may prevent us from experiencing a second wave. It goes on to say that a second peak in the first wave, a situation in which the virus hasn't not been suppressed enough to quell transmission to end the first one. It sounds a bit confusing. Basically, if we interpret that for our local situation, our first 115 cases, according to WHO's analysis now, means that our first 115 cases was our first peak. 115 to 130 cases now will build to a second peak if we do not continue the public health measures, and if we succumb to all the pressures to have this uncontrolled opening of borders. And I want the country to understand that if we are to manage a second peak of the first wave, we cannot give in to the pressures to simply open our borders. The Minister of National Security and the Honorable Prime Minister addressed this in the Parliament yesterday when he was asked about opening of borders. And we can't simply give in to the pressure, no matter how great, to just open the borders. At the Ministry of Health and as a country, we are always having our eye on the next goal, the next target, as to why we have to implement the measures we have to implement. The next major target that we as a country have to look forward to opening up is our schools in September. We want our schools to open for all the obvious reasons. Teaching has to go on in a classroom setting, the psychosocial benefits of children being in a class, forging relationships, teachers being out. And if we lose the plot now, by giving into all of these pressures, and you start to have uncontrolled community spread, think about what that may mean for the opening of schools. That is why we took the decision last week when we saw the behavior in bars and pubs to roll back that, because we have a country to protect. Many aspects of the economy are open and are starting to recover. But when you look at the demography around the world of who is being affected now and why, the current peak in this same wave is being driven by new infections in people in their 30s, 20s, and 40s because of their social behavior in going out to pubs, bars, and restaurants. That is what is driving this peak in the first wave of 11 million people. And we are seeing that same type of behavior in Trinidad. So that is why we had to roll back the opening hours of bars especially. The baton has been passed to the public, and we must heed the warnings of the international community, and we must heed the warnings that we are seeing locally. So I wanted to bring this new analysis to the attention of the local population as we look forward down the line to further openings, that every measure we take is driven by science. Every measure we take is being driven by keeping 1.4 million people safe. So Minister Cox, I want to thank you for this opportunity and hope that we have brought a sense of reality and realism to the conversation on COVID-19 this morning, and I thank you very much.
Thank you very much, Minister. At this time, the Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update.
Good morning,
Dr. Parasram.
Honorable Ministers, Dr. Doon, members of the media, members of the viewing and listening public. The status update for Saturday, 4th July 2020. Total number of tests done, both public sector, UWI and CAFA, 5,401. Number of unique patient tests completed thus far, 4,147. Number of samples repeated, 1,254. Total number of community tests thus far, 1,931. The total number of positives stay at 130. Total number of discharges are at 15. Number of deaths remain at 8. And number of hospitalized patients at the Cora facility remain at 7. In terms of our quarantine sites, we have 498 persons quarantined at this time at various sites. The Cora Hospital, we have currently 23 individuals. At the Couva Medical and Multi-Training Facility, we have 142 persons. At the UE St. Augustine Debe Penal Campus, there are 19 persons. Chancellor Hotel, we have 20. At the Tacarigua facility, there are 40 individuals. The Napa site for healthcare workers, we have 13 persons. Sandy Grande Brooklyn Center, there are 32 persons. The Balandra site, we have 42 individuals. UE Freedom Hall, which are the repatriated students, we remain with 45. Cascadia, there are 12. At the Merce Developer Rig, there are 94 individuals. And Vision on Mission, Claxon Bay, remain with 15 persons. Minister Cox, that's my update for this morning.
Thank you very much, Dr. Parasram. Dr. Rohit Doon, Advisor, Health Promotion, Communications and Public Health, will speak on COVID-19 protocols for the homes for the aged and long-stay residential homes. Dr. Doon.
Good morning, Ministers. Chief Medical Officer Dr. Parasram. Long-term care facilities have long been designed to accommodate mainly older persons with a multiplicity of chronic health conditions. They are often at increased risk to infectious diseases in general, and now with COVID-19, they are extremely vulnerable to severe and sometimes fatal complications of this illness. Some of the risk factors that are more prevalent in the older persons than in the general population include compromised immune response, chronic disease such as heart disease, diabetes, hypertension, cancers, and mental health disorders. It is useful to know that the vast number of challenges for folks in the homes are mental health disorders, namely Alzheimer's. But let me refer back to, and of course they are living in close conditions, so again the ease of spread. When we talk about the chronic diseases and the prevalence in the older folks and their involvement in chronic complications of COVID exposure, in this country, in the general population, the prevalence of hypertension is 30%. So you can imagine in the older persons it is concomitantly higher. So the risks are very great. Hence the reason for targeting the long-stay facilities for special attention, because they can be considered as an extremely vulnerable segment of a population and deserve extra attention. Now, in early March to middle March, the ministry, being well aware of these facts, prepared a pandemic influenza COVID preparedness plan for these long-term facilities and implementation plan. This is what the implementation plan looked like. It is essentially based on infection and prevention and control in these facilities, and there are a set of guidelines. Now, to implement such a wide undertaking, because there are over 220 homes in this country, we had to build partnerships, and the Ministry of Health and its delivery of health services use this as a strategic tool in building partnerships to achieve national objectives. So we sought to build partnership with the association that represents the long-term care facilities, and they represent over 170 odd facilities. We partnered with the Ministry of Social Development, and we invited the association to the ministry and initiated a training sensitization program using our IPC, or Infection Prevention and Control Guidelines, which they agreed is such a wonderful way in which to protect the residents of these homes. The mechanism of implementation would require us in strengthening this partnership, so we train them and refer to them as training the trainers, and then they go back out and train their operators of these facilities. And every one of those facilities would have a copy of these guidelines and our plans, and they are going to be continuously updated by their associations. That's a mechanism of communication. So this implementation plan has about 6 or 7 components. The major component of it is really to effect behavior change, as you heard the minister talk about behavior change in the general population. Well, it's the same principle we are applying in the facilities: behavior change and modification, and environmental change and modification. But to do so, we need to engage the entire arm of the Ministry of Health. The Ministry of Health, one of its key strategic functions, core functions of the Ministry of Health, is risk factor identification and prevention and control of those risks to health. We've got a team in the regional, in our regions, in the community setting of what we call county medical officers of health, of which there are 8 in this country and 1 in Tobago, and they each would have a team of doctors, nurses, and public health inspectors. So they are, in other words, the ears and the eyes of the Ministry of Health, engaging in risk factor identification, prevention and control, and surveillance and monitoring. So that's the mechanism, that's the institutional arrangement and architecture that the ministry has, and it's very robust, and they're operating at every level. So that's the main purpose of the community presence of the Ministry of Health, is to ensure that these guidelines are adhered to by the practitioners out there in the long-term facilities. The second component of this plan will be to ensure that we prevent the advent of illness into these facilities. And to do so, we adopted the attitude of identifying focal points in each facility, and that is where the association came in. They were going to manage that process for the Ministry of Health, and we are going to monitor and evaluate that process. So these focal points will manage, they will utilize these guidelines and manage the prevention of the COVID illness in the facility. And these guidelines would include the same thing that the minister mentioned about hand hygiene, cough etiquette, wearing of masks, social distancing, and keeping of a daily symptom log on all of their residents and staff in the facility, so that at any point in time when our team goes out to inspect, they will have sight of this daily log and could confirm that no one would have had any COVID-like symptoms. And they would also examine the facility and inspect the facility for adherence to the application of the personal protective equipment that may be available, and also the social distancing practices and protocols, and the environmental hygiene status in the facility. So it's a continuous assessment program that we have ongoing on the ground, and quite often you will find that some of these agents of ours on the ground will do daily calling to find out what's happening and get reports on the symptoms, presence or absence of any symptoms in the facilities. The other major issue is the prevention of transmission within the facility, because our major goal for this intervention is to maintain and protect the health of our citizens in the long-stay facilities, and to prevent an outbreak of COVID-19 in the facility. Because, you know, one case could lead on to many more in these close living conditions. So that's the other key element of the package of protocols that we've produced and circulated. And it centers on early detection of the illness, isolation of a suspected case, communicated with the county medical officer of health, who will then send a team to confirm a suspected case and move to the next stage of testing and isolation at a health facility if necessary, and quarantine, etc., etc. So that's the second major intervention there. The other issue is about social distancing. So we practice social distancing in the facility also. Social distancing means that we are not going to allow visitors to enter the facility, or the residents to make visits outside. And in terms of meals and so on, where they have general meals, usually together, we are advocating staggering of meals and ensuring that we have the six foot distance between residents while they are in groups. So the social distancing principle that we recommend for the public areas is very similar to what is taking place in the facilities that we are managing. The other thing is that we talk about sterilization, which is very important. We need to prevent transmission, and you will only prevent transmission if you have sterilized environment for the use by the residents. Monitoring of staff also is a component, and environmental disinfection and provision of consumables and appropriate wearing of PPE and so on. In this regard, the ministry, knowing that we have partners, we were able to support the association with provisions of a number of gloves, masks, goggles, and thermometers, so that they can establish their daily symptom log and do the measurements so that we could examine and keep a close eye on the situation. So that is in broad scope what the IPC protocols are all about. Now, what has happened in the meantime? What's the result? These, you will recall I said we implemented these guidelines in the first week in April. And it's 3 months now. So I would like to report the progress. I'm pleased to report there have been no cases of COVID-19 in any of these facilities. So that's good news. And in that regard, we have been having reports from our CMOHs on a regular basis to head office, informing us of the adherence, the level of adherence to practice and adherence to hygiene standards has been quite satisfactory in the main. The other major issue at hand now is that we've had a request for to reintroduce visitors back into the setting. And we have agreed to do that, and recently I had a meeting with the residential folks and the association, and we developed some guidelines which were going to be used to commence visitation back into these facilities. The guidelines are not going to be any different from what is the practice there in the facility, the guidelines that we ensure that the staff use. So, for example, all visitors will have to be admitted by appointments only. And on the phone, we can do a quick symptom check to ensure that they don't have any fever or cough or any COVID-like symptoms. Otherwise, they will certainly not be allowed to enter and visit. So, visits by appointment only, and these visits will be conducted in an open-air setting. Wearing of masks mandatory, hand hygiene mandatory, and for the residents, they too will have to wear masks during the course of this visit by the relatives or friends. All the protocols that would generally exist in the community of the long-stay facilities on any given day will be as same. There are going to be no changes. The visitor will have to conform to all the IPC practices and protocols that the staff conform to. So physical distancing, temperature checks when they come in, use of face masks, hand hygiene, and we're going to establish a visitor log just like we have for the patients, not for the patients, but for the residents and for the staff in the facility. So that's in a nutshell where we are today, and it's a good place to be where we are going to restart and have restarted this week, by the way, allowing visitation back into the facilities. So with that update, I will say that to summarize, I will just want to reinforce what the minister had said. You know, we could beat this virus together. Just stay 6 feet from each other. Wear masks, don't touch your nose, your mouth, your eyes, and wash your hands for 20 seconds. Thank you.
Thank you very much, Dr. Doon. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. So let us keep this in mind as we begin taking your questions. 98.1.
Panel, Stephen Cummings, 98.1 FM. I'll go quickly with my 2 questions, one for Minister Dayal Singh and the other for the CMO, Dr. Parasram. First, Minister Dayal Singh, just for my edification, I'm not sure how these matters apply, but the question is COVID related. In the event of a special, unique need to act in further safeguarding the public, are you still free to make any necessary, unique adjustments to the public health regulations now that the Parliament has been dissolved? My understanding is that when Parliament is dissolved, there is loss of access to parliamentary facilities and resources. And the CMO, is it now that our medical experts in Trinidad and Tobago should be taking yet another look at the possibility of children being at greater COVID-19 risk levels? We have seen over the past days a report of an 11-year-old boy in South Florida being the youngest to have fallen victim to the COVID-19 virus. And what is also interesting is that it is said that this unique case was not travel-related. So the virus appears to be trending towards a younger population. Should we be taking yet another look at our children here? Thank you.
Yeah, thank you. So I'll address your first question, Mr. Cummins. It is the question you just asked about Parliament reflects a question that was asked 2 months ago when one media personnel questioned the Attorney General and myself, why aren't these regulations being debated in Parliament? These regulations do not have to be debated in Parliament. These regulations give the authority under the Public Health Ordinance, where the Minister of Health can sign off on regulations that do not need parliamentary scrutiny or parliamentary control or parliamentary oversight. So I think that is the position. And yes, if a situation does arise that needs altering, and to use the word of WHO, which I read out recently, contouring, the Cabinet has given the Minister of Health, the Minister of National Security, reporting to the Prime Minister, the authority to recommend further measures, and then the Attorney General, together with the CPC, the Chief Parliamentary Council, constructs these measures, writes the measures, and I sign off on them, and they come into effect once they are gazetted. So that's the sequence of events. It does not require or need or depend on a parliament being in session. So I hope that answers your question.
CMO?
Yeah, so I think the recent cases of children being affected underscores what has been known for quite a while in terms of the epidemic. So in the early days, we would have expected, as soon as the epidemic started in the early part of the year, January, February, that it would have affected primarily the elder person. Maybe into March, we found out, and there were reports out of China and other places indicating that there were thrombotic phenomena occurring in childhood, like Kawasaki's disease, for example. And we have taken note of it, and particularly beyond children being affected, children can be, even in an asymptomatic phase, can be a conduit to spread to other at-risk groups as well. So we are being extremely cautious with children for many reasons, as we have said many times before, and we would really like our children to be safe, and that is why our guidelines suggest that we hold child-related activities until September. As we discussed before, of course, the exemptions has been given to have certain examinations, for example, SEA. So in that regard, exemptions are being given and guidelines are being followed. But aside from those, parents are being asked to pay particular attention to your children and have personal responsibility in the way we take them out of their home, making sure that they are safe at all times.
Mr. Cummins, I forgot the last step in the process for the regulations. Once the regulations are signed off for, they have to be authorized by the Cabinet. So I do have Cabinet authority and Cabinet cover for every single regulation. So that's the process. Cabinet signs off on it in the end.
Thank you. We move to Newsday.
Good morning, Marissa Fraser from the Newsday.
Morning, Marissa.
My first question is in relation to the 94 that are quarantined on the developer rig. Is it that workers from that particular rig began showing symptoms and had to be quarantined, or does that number include workers from other rigs that were brought there? And the second question is in relation to elections. I know that the ministry is working with the EBC to provide guidelines for the date. But given the length of time it usually takes without these guidelines and restrictions, do you foresee it running smoothly and in a timely manner on that date, given all the social distancing and all of that? Or do you feel like there would end up being an extension? Thanks.
Okay. So in terms of your first question related to the rigs, that particular rig was actually brought into our waters, and we're using it as a quarantine vessel, similarly to the vessel Enchantment of the Sea. So it's a similar sort of process, and they are being monitored every day with temperatures, temperature checks, and of course the necessary polymerase chain reaction. So it's not a mixing of individuals, though, that we saw with the Enchantment of the Seas. It's an actual vessel, a rig that would have been offshore and brought into the waters to facilitate a quarantine-like setting. So that one is a little different. With regards to the EBC and your particular question as to extension of hours, I think the electoral process in the past would have lent itself to some of the measures, public health measures that we already have in place. So we have been working closely with the EBC to ensure that they are aware of the guidelines that should be put in place. On Friday, I would have shared a final draft of a guideline which we want to publish for the election process, at least to be used in the polling stations on the particular day. So the guidelines that are being followed. The key premises, of course, are social distancing as you go in. Mask wearing or face shields should be worn at all times by both persons coming into the center as well as persons working within the centers throughout the course of the day. They should have sanitization of your hands or washing of your hands before and after entering the center or leaving. And it should be witnessed by a member of staff from the EBC to ensure that it's being done. Sanitizing before or after of the actual ballot X that we use, the stamp. That is extremely important, as we don't want persons to transmit any diseases by touching. So those are some of the guidelines. On Tuesday next week in the afternoon, there will be a mock polling station set up by EBC where Ministry of Health will be a partner to ensure that the guidelines are rolled out in the way that we would like them to be. And once that goes successfully, we will publish the guidelines to the population.
Thank you. TDT? It seems as though TDT is not hearing.
All right. Good morning. Ian Wilson.
Morning, Ian.
Good morning.
Hi. Well, of course, the health minister was very careful in pointing out that we are still in the first wave, and some countries are, in fact, in the second and third peaks of the first wave. Now, what really would mark the end of the first wave and signal the start of the second wave? And secondly, it's an election question. I'm hoping that I will see some of the EDC officials coming at some stage to answer these questions. But would you recommend, of course, at the polling station, a lot of people will take their voting times in the morning or some in the evening, and they will have a cluster of voters at certain times during the day. And then there are certain times it will have a downtime where there are not much people at the polling stations. Now, with the social distancing, would you recommend some like a staggering time, a staggering time so that it will be, the polling stations would be constant during the day and not have clusters of voters either early or late in the evening?
Okay. So in terms of, let me take the second question as it follows from the last one, right? So in terms of the EBC, as I said, it lends itself to public health measures, meaning when you go to a polling station to actually vote, if you have noticed, there is social distance that is applied even before this public health measure. You can't be a certain distance away from the person in front of you. So that already exists. There's supposed to be no congregation in the vicinity, so that exists as well, which is part of the recommendation. So I don't see it being completely different from what has happened in the past. There's a further emphasis on hand washing, sanitizing, face shields and masks, which would not have been there in the past. But I don't think that they will add to the time that it takes to have the voting being done. So I don't think it will impede anything in any way. With regards to the second peak, so on a daily basis we follow the WHO updates. So they do situational updates saying how countries go in the last 24 hours. So you see some countries downtrending, you see some countries uptrending, right? And that is how basically epidemiologically you look at see where you are in terms of the epidemic. For instance, you have seen Canada come down significantly in the numbers over the last few days. They have actually, up to a couple of days ago, only reported a few hundred cases in Canada. Conversely, we see US up to yesterday. For the last 24 hours, the United States reported 54,271 cases. All right? Brazil, similarly, 46,712 cases within the last 24 hours. So both countries combined are looking at 100,000 cases in the last 24 hours. If you go back a couple of weeks, they would have been somewhere in the region of 23,000 cases per day. So obviously they went down a bit, and now they're going back up. So it's a second peak of the first wave occurring in those countries. So we basically look at the trends that we get on a daily basis and see if they're going upwards, they're going downwards. A lot of the countries around the world have gone through their first peak and are on the way down. But in the region of the Americas, of which the Caribbean is a part, we are seeing that we're having an upsurgence over the last few weeks.
Minister, you have anything to
No,
add?
that was well done.
Okay, thank you. Just want to remind you all that we also have Dr. Rohit Doon here, who is the advisor, public health, health promotion and communications, and he's here to answer questions as well. 91.9.
Hi, good morning, everyone. Vern X Devon, 91.9. I just wanted to ask the minister if they could give us some kind of information, looking at how the data and the statistics are going, these 11 million cases, and the fact that we are still in the first wave. Have you all gotten any kind of inkling as to how long we can expect the pandemic itself to really last, and how soon some kind of relief? Is there any update in terms of vaccines or cures or anything to that effect? Because we know it had some talk about a cure some time ago from the African region. If there's any update on that, that would be appreciated. And with respect to the types of persons that are susceptible to contracted COVID, with the instance of the children, coming up, is it that it's not only our older people now who are going to be susceptible to succumb to, real symptoms and even death from the COVID-19 infections? Is it that we have to look at the entire population being very, very much at risk of being, adversely affected from the virus? Thank you.
Vern, so you are asking the million-dollar questions, to which I don't think anybody has an answer as to when this is going to end and so on. I don't think anybody can predict when this is going to end. The theoretical, and notice my words, the theoretical end of this pandemic is going to be dependent on several factors. One, the development of a vaccine. Two, the development of a therapeutic to treat cases. We see remdesivir seems to be a drug which shows a lot of promise for acute cases in a hospital setting. We had Dr. Parkinson talk about that here a couple of weeks ago. The use of anti-inflammatories like betamethasone, which is another therapeutic. So the end of this is going to be dependent largely on vaccines. There is a lot of early encouraging, I don't want to use the word data, because people are starting to question whether the information coming out from these vaccine developers actually constitutes sound data. There seems to be a lot of early encouraging signs that phase 1 and 2 of early vaccine development are encouraging. The Oxford group, Moderna out of the United States seem to have an encouraging vaccine. Different people, different experts are giving you different timelines for vaccines. The more optimistic timelines talk to early 2021. The lesser optimistic timelines talk about middle 2021, end of 2021. Let's hope and pray. Type of persons, Vern. In my opening gambit when I spoke, I said the world now is seeing a change in demographics. Demographics means things like age, gender, where you live, and so on. And the disturbing signs recently is that you have a reversal of what we thought earlier on. Earlier on, we were focusing on the elderly, and we said that the young and the children may not be that seriously affected. Now, as this washes through the global population with 11 million cases, and you get more experience and more data, you are seeing more and more demographic changes with people in their 20s, 30s, and 40s being seriously affected with blood events, thrombotic events, strokes, and so on. And that is what is worrying many countries now as bars and beaches open up. The reason why we are taking such a, I will use the word hard line on children, prior to the last couple of months, we thought that children could brush off this thing. Now you are seeing the opposite, that children, young children, are really being adversely affected. So it's not that we want to punish children, punish nurseries, punish preschools. It's just that we are paying attention to the global demographic changes as to which populations are being affected more and more. It's not only the elderly, it's now the people in their 20s, 30s, 40s, and children. So, Vern, your question is spot on. We have noticed the type of persons, the demographic changes that are taking place, and the death rates of the elderly is coming down. But then the death rates of people in their 20s, 30s, and 40s is going up. So that is why we have to be so particularly careful as we manage now what we hope will not be the second peak of our first wave. So I don't want to be Chief Medical Officer.
No, I'm okay.
I did well as you did
Yes.
well with the EBC.
Yes.
Excellent. Lovely. Thank you.
Okay, thank you. I have a question from online. Someone wants to know if karate classes for children
I think that's the same.
was given the okay to start back, since the person is saying that they remember the minister stating all children's activities or anything with children will
Yeah.
resume in September.
Let me reiterate, anything with children, and this is one of the gray areas, as I said, a child by law is defined as anybody 18 years and under. So what happens to the 17-year-old who wants to play pro football in pro sport? Look, we are asking parents and associations to apply some common sense. We are doing these things to save your children's lives. Protect your children. Protect your toddlers, your under 10s, your 11 and 13s from contact sports. It is difficult to be overly prescriptive of all times, but we are trying just to keep people safe. And as I said, if we keep in our minds the next step is schools. We want schools to open. And I think the Ministry of Education and the government has said there's a commitment to open schools in September. But if we try to push the boundaries too much now with karate, this, that, and the other, and you start to get spread within your school-age population,
Yes.
what it means is that we may have to revisit the opening of schools.
Yes.
And we don't want that.
Correct.
So don't push the boundaries too much. Don't say because there isn't a law that you can't have a karate class, I'm going to have a karate class. We are asking everyone to apply some common sense, to be careful, and keep the next prize in sight. The next prize in sight is schools,
Yes.
because we want schools to open. But we don't want anything by pushing the boundaries now that could start up spread within that school-age population to delay the opening of schools, because we want schools to open. So just apply common sense, have some patience.
Okay, I have another question, which I think I myself might have been concerned about. And someone is asking if if you all thought about administering the electoral ink with a medicine dropper, because last election, the person said that they were made to dip their finger in a sponge immediately after a man who was urinating outside the polling station.
I will let the CMO do that one.
I think the critical part of it is that we would have witness hand washing
Yeah.
as you enter the polling station. So it has to be witnessed by an officer from the EBC, whether hand washing or hand sanitizing. And of course, having the electoral stamp being sanitized before and after as well. But the critical thing is hand washing and the mask wearing. So
Good.
when we do our mock on Tuesday, we will look at the ink in particular and the application. And then, of course, if there are any changes, then based on what we see, we can make further recommendations. But for now, I think once your hands are clean as you come in, we should be okay.
Okay.
Good.
Thank you. So that also allay my concerns also.
Ladies and gentlemen, you will notice I am answering no questions on elections, because there will be a conflict of interest because I'm a candidate. So any questions with election goes automatically to the Chief Medical Officer.
Okay, so I would like to go back to 98.1. And one question, please, Mr. Cummings.
Yes, thank you so much, Minister Cox.
Morning, Mr. Cummins again.
Welcome.
I always appreciate your, engaging me. And again, I want to go back to the Chief Personnel Officer. The Chief Medical Officer. My apologies. CMO, we're talking the elections and the EBC. I think I posed a question earlier on relative to persons who have been or who would be caught into a quarantined type situations during the selection process all the way up to polling day. Has there been any discussion with the EBC as to how that is going to be treated with? Because we do have persons who still have the constitutional right to cast their ballot, irrespective of whether they might be in quarantine.
So yes, so there's a special section in the guideline that speaks to persons that are in quarantine, which we have shared with the EBC. So basically, there are a few persons that would have been in quarantine that would have had to sign personal documents, for instance, for pension, while they were in quarantine. So how we manage that is that we have something called a hot zone and a cold zone. There's a way that we treat the actual piece of paper, taking it from the cold zone into the hot zone, so we have them sign or stamp the necessary paper. So this will be a function of the County Medical Officer of Health overseeing the particular quarantine station or stations that the persons have to vote from within. So we will get those things operationalized, but the process has been used before. It's just a matter of ensuring that the actual ballot is properly sanitized before it actually goes in for counting, as well as making sure that the hot zone and cold zone remits and the IPC measures that we have in place, they also conform to those things. And that's why we're putting it in the hands of the CMOH to ensure that there's compliance there. So the way we see it working is, of course, the ballots are taken in with the stamps to individuals, and then the sanitization occurs as it comes back out, which we do with clinical notes as well of patients. Sometimes they go into a hot zone and then they have to come back out. There's a mechanism of sanitization that occurs, and then that will be sent on to the EBC.
Before I move on, I didn't want to forget, Minister, I want to commend you and your staff, including the CMO and his staff, with the great work that you all have been doing. I think it was yesterday, I saw a story by Liz Williams, one of our regulars, concerning a person who was in quarantine. A very positive story. I don't know if you saw it on Belandra.
No.
And the gentleman, I think it's Mr. Alexis, he spoke about the nurses and how well they were treated at the Belandra facility. So it was really good to hear something that positive coming from someone who was in quarantine about the good treatment that he received. So, good story, Liz Williams. I think I see 91.9 hands up again. 91.9, one question, please.
Yes, hi. Just one further question. Thank you very much, Minister Cox. This one is to Dr. Doon, and just to make sure we include him in the conversation, because a lot of political parties tend to go to different areas to retrieve older persons to carry them to vote. Have you all looked at putting any guidelines in place or instructing political parties and persons engaging those older persons to carry them to vote in terms of guidelines for that particular process on election day?
Before
We
Dr.
haven't,
Doon answer,
addressed
just
that.
wanted to say that it's not political parties go for the persons, their parents or their go to take them to vote. It's not the political parties. Okay, Dr. Doon, go ahead.
Well, I haven't, just yesterday the announcement for elections came by, so I haven't begun to think about it, but by the next day or so, I'd be well prepared to provide some guidance on that. But the essential, as you know, now with those older persons, we are only limiting visitors into the facility, and we haven't begun the stage of where they usually sometimes go on outings, etc., and so on. So we haven't begun to contemplate permission to do those things. So leaving the facility and going to vote in a voting booth, we'll have to. I'll have to get back to you on those guidelines that will be prepared within the next 24 to 48 hours.
Okay, thank you. TTT? One question,
Well,
please.
This question would, of course, be for the doctors because it's another political question, elections questions. We've seen some of the political parties engaging in virtual meetings, and rightly so. But of course, we all know that it's not the same as being out there with your different color jerseys and your flags and things like that. Now, of course, the question is, will there any provisions be made for the elections campaigning, maybe to have more than 25 people, or will rallies be limited to 25 people, or different things like that?
So, I mean, the regulations as it stands now stands at 25. Of course, as you have noted, it went from 5 to 10, then to 25. In the coming months, I don't think the decision will be based on having a political rally. The decision will be made based on the status of the health of the population in terms of the epidemiology of disease, whether we go to 50 or thereabouts. But that decision will come in the coming weeks. But even if we go to 50, it's not a large. We're talking about congregations of thousands of people. And we have seen the impact of people congregating in other parts of the world with escalations in epidemics occurring a couple of days later. If we go back to the Spanish flu of 1918, we had a release of the restrictions. 3 days later, they had an explosion of the Spanish flu, which was almost larger than the first wave in those days. So we know what will be the effect of congregation in that large number and what can be the effect, and we're very cautious as to how we make decisions related to it.
Thank you. Newsday, one more question, please.
Hi, this is kind of both a question and a plea, either to the health minister or the CMO. Please address the people who are wearing masks, but their mouth alone is covered and they have their nose exposed still and their defenses, but I'm wearing a mask. Please address those people or that group of people. Thanks.
Thank you. That is another $1 million question. I think Vern asked the first $1 million question. You are asking the second $1 million question. Look, the issue of masks and all these precautions is what is going to continue to distinguish if we have a second peak of the first wave. These simple public health measures cost very little. You can make a mask home. You can buy a mask on Frederick Street, San Fernando, Tobago for as little as $10. The issue is some people feel that having the mask protects them. Having it around your chin protects you. In your pocket protects you. And Narissa, you have raised a very important issue, and I want to thank you. The public has to get on with wearing the mask, covering your mouth and nose, especially when you are talking. What you see sometimes, Narissa, is people wearing the mask, and then when they want to talk, they pull down the mask. That is the time you need to wear the mask, because that is when you get droplets. That is when you get spit. That is when it can come into your mouth and your nose. And in in closing, if I
Yes,
may,
go ahead.
in closing, if I may, there's a report now circulating, and we dealt with it, I think, 2 weeks ago with Dr. Wheeler. Whilst the virus is not mutating, there seems to be certain changes, certain strains. And what people are saying now is that these new strains seem to have a higher degree of transmissibility and could attach to your nose and your mouth and get into your respiratory system even easier than the earlier strains. The virus has not mutated. With each virus, you get a slight drift in the genetic material over time. That is why the flu vaccine for 1 year is different to the flu vaccine for the previous year. You get slight drifts, slight changes. So this simple mask wearing is crucial, Narissa. It's absolutely crucial that you wear it when you're out in public and wear it especially when you are speaking or being spoken to. Wearing a mask is not a sign of weakness. Wearing a mask is not waving a white flag and say, I have given up to the virus. Wearing a mask tells the people, look, I love you so much that I don't want you to get the virus if I have it, because we must pretend that everyone has the virus. And when you wear a mask, you are telling somebody, I regard you so much that I am wearing a mask, so in case I have the virus, I don't give it to you. So we could end on this note that mask wearing is one of the most crucial public health interventions that you, the citizen, can do. And I'm appealing to all places of business to adhere to the simple protocol because it is breaking down. No mask, no service. From the roti shop to the mall to the gas station, everywhere, to planes, simple. No mask, no service. Thank you very much, Minister Cox.
Thank you very much, Minister. Thank you very much, doctors. Thank you, members of the media, and to our viewing and listening audiences. We've come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. As we go, we would like to remind you to adhere to the public health guidelines in place as we adjust to the new normal. And this means you must wear a mask over your nose and mouth when you go out in public, keep a distance of 6 feet from each other, stay home if you are ill, clean, then sanitize surfaces, wash your hands often with soap and water or use an alcohol-based hand sanitizer. And it is important to cough into a tissue or into the crook of your elbow and avoid touching your faces. If you or a loved one develops symptoms of COVID-19, please call the hotline 877-WELL or 800-WELL. For further guidance, if the person is severely ill, call the 811 emergency hotline or call ahead to the accident and emergency department of your nearest hospital for help and go in immediately. Remember, no mask, no service. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19. Stay safe. May God bless Trinidad and Tobago.